Welcome. You're tuned to Resilience Radio. I'm Irvin Eisenberg, host of the show and owner of Resilience Occupational Therapy. The opinions on this show are not necessarily shared by me. I like to feature a variety of different perspectives, and everyone has different healthcare needs. Additionally, none of this is meant to be medically diagnostic or prescriptive in any way. Today's guest is Grace Johnstone. She's a doctor of chiropractic and certified in hyperbaric and undersea medicine. She's owner and practitioner at Hardwick Chiropractic in Hyperbaric, Vermont. Great to have you on today, Grace.
Thank you, Irvin. Good to be here.
So this is going to be a two-part episode because you've got those two distinct parts to your practice. And this first episode will be discussing the chiropractic. Could you start off by telling us what drew you into chiropractic?
Well, certainly. Life presents us with things that often look like major challenges that turn into some of the biggest gifts, right? And I was in a situation where I had a car accident and was injured and wasn't recovering well. And someone suggested I go to a chiropractor, which had never occurred to me before. I did, and that really allowed me to heal, and in fact addressed some issues that, even though I was really strong and healthy, I realized that I'd been sort of carrying along with me. So that was my introduction. And then as I learned more about it, I just realized for me what a good fit it was. It really involves working with your hands, but also your heart and your head. It involves constant learning and growth. There's a tremendous amount of depth when you're working with people in a healthcare or healing environment, and it's fascinating. So it was the perfect thing. I just had to get hit by a truck to recognize it.
Well, I'm sorry you were hit by a truck, but I'm glad to hear that it helped you onto your path.
That's right.
So it's my understanding there's a lot, like for most things, there's a lot of different types of chiropractic and focuses within it. Could you speak a little bit about what it is you do uniquely and what you and how that sort of is different than other types of chiropractic?
Sure. I think it's if we think about different ways. I will back up. There are many different chiropractic techniques, you're right, and some of them are quite different. Each of them have their own way of assessing what the person's physiology, what the system needs, and a different way of prioritizing that and delivering information or a force or input into the person's physiology and into the system. Some of these techniques are more geared towards what we call the osseous system, or the bones and the joints. Some of them are more geared towards connective tissue. So again, that could relate to joints, but fascia, the meninges, the covering of the brain and the nerves, that's connective tissue. Connective tissue goes throughout the body and is really important in how the body literally defines itself. Some techniques work more directly with the brain and the nerves themselves. There are approaches that work with the organ systems, so directly working with the stomach or the cardiac sphincter or the pericardium. So there are many different techniques. And each of them you could think of as a different way of languaging with the system, a different way of giving it information and assessing what it needs. So in our office, we are trained, in addition to sort of the standard chiropractic, what you learn in school kind of thing that gets you a doctor of chiropractic. We've all done a fair amount of postdoc work, some in chiropractic, some in osteopathy, which has given us the ability to really directly work with, as I said, organ systems, with the brain and the nerves or the nuclei or the limbic system itself, in addition to working with what we think of as more traditional chiropractic, kind of muscles, joints, bones, the spine, that kind of thing. So we have a lot of different techniques that we use, and we use them within a model and approach that's called BioGeometric Integration. And that is an approach that we actually teach to other chiropractors, which lets us really look at, when you're working with someone, what is the technique or the language, if you will, that will give us the most access and with the most ease in helping them address whatever the issues are. So that may be one thing one day or something else another day. It translates in a way that means that one of the things we know is that the connective tissue really defines a lot around someone's physiology, around brain function too, but around biomechanics, all of that. And that's a good starting place. That's often a first priority. And so working with the fascial systems, the connective tissue systems, that's generally very low force, gentle work. Mm-hmm. Likewise, when you're working in the brain directly or on peripheral nerves or cranial nerves, you don't need a big hammer there, right? That is very gentle work. Nerve tissue is meant to perceive, and it's capable of understanding information and force frequencies in ways that are so subtle we can't even measure them yet, right? I mean, you don't think about vasodilating when the wind changes, or when your mood changes, for example. You know, what happens in the physiology? It changes muscle tone, changes posture. There's so many dynamics there that are just amazing and that make perfect sense. It's just that even with a low force approach, it's still a lot of input. So as I said, depending on who we're working with at that situation, whether there's issues with the central nervous system or the organ system or a knee, that will all inform how we relate to that person and what kind of approach, technique, if you will, we use to help them.
Okay. And to sort of break it down a little more, I know a little bit about network chiropractic, and some of the listeners may as well. How is that different or the same as as this broader approach that you're describing?
Great question, Irvin. I did network chiropractic. I trained in it for 10 or 20 years. And this work, BioGeometric Integration, or BGI, we call it for obvious reasons, grew out of network chiropractic, where network tends to focus really on spinal issues and the spine itself. Mm-hmm. BGI has sort of expanded that envelope and works with the entire mind body. So again, that may be the kinetic chain. It involves more of the limbs or the scapula or the cranium itself, or it may involve working with the sphincters in the gut, or whatever is the most appropriate for that person at that time. It just allows us, I think, both a bigger envelope and more refinement. They are both tonal methods in terms of how they articulate with the system, and tend to be, definitely lean into the low force thing, although there are occasions when you'll have a more spontaneous, osseous kind of input. Yeah.
Okay. And this BGI technique, is this something you've developed, or where did you train in it?
No, it was actually developed by a doctor named Sue Brown, who is out in Chicago area. And it's been around for, well, let's see. I am on teaching staff for them, so that's been about 20 years. The work was evolving before that within the network kind of framework, if you will. Mm-hmm. And then it really needed to move outside of that as the picture got bigger and bigger. So no, I've done extensive training with Sue, who is actually no longer with us. And we have a trained teaching staff that teaches throughout the world at some of the chiropractic schools here, some in Australia and in the UK. We have some teaching staff in Italy. So it's something that is available to chiropractors worldwide.
So it seems like your personal practice has developed sort of in parallel to how BGI has developed, that you started off with the network and moved from there and are actively teaching that. Can you tell us a little bit about Hardwick Chiropractic? Who's there, and are you all doing BGI, or is there more happening there than that?
It's hard to have more happening than BGI.
It's a pretty large umbrella. I realized as I was saying that.
Yes. But good question. So there are 3 docs here: myself, Dr. Rick Eschholz, and Dr. Sarah Crandall. Rick has been doing this also for decades. Sarah has been doing it, gosh, well, she started studying BGI when she was in chiropractic school. So that's got to be 5, 6, 7 years. We all do postdoc training and seminars. We do some teaching as well. But so we're always adding to that, whether it's new work with neural tissue or with visceral tissue or more chiropractic. Dr. Sarah and I both also work in the hyperbaric here. And so she also helps me with that. Mm-hmm. And what else? Let's see. We have a little bit of, we do a little bit of animal adjusting, dogs and cats, primarily for patients who come in. But actually, we often get referrals just for dogs, and then maybe they refer their people. But usually the people come and then they bring their dogs. So there's a little bit of that. We've got a great practice. We see a wide array of community people and people from, Burlington and New Hampshire and elsewhere too, because this is quite unusual, the work that we do. So I'd say, it's an interesting, fascinating place to hang out.
So where do you see your chiropractic practice in the scope of the Vermont healthcare landscape, as far as what is your interaction, if any, with medical doctors or massage therapists or other type of healthcare practitioners?
We certainly get referrals from them, and sometimes from people in mental health, because we'll be often working with people who are dealing with anxiety issues or depression or PTSD, that kind of thing. There's some overlap there with the hyperbaric as well. And we certainly also give referrals to people who seem as though they would be a good match for the people that we are working with. Mm-hmm. If there's an interest there. We're not a practice that really pushes things on people, Mm-hmm. But we certainly want to bring in whatever other aspects would be helpful for people. And sometimes that's, a Lyme literate doc to get assessed for whether there's Lyme or tick-borne disease behind some of these symptoms. So I'm not sure if I'm answering your question adequately.
Well, I guess part of the question is I know some chiropractors present their practices more as primary care and sort of first line in general health. And I didn't know if you viewed the doctors at Hardwick Chiropractic in those terms, or more as specialists in a particular area of health, so to speak.
Well, we certainly are the first go-to for, I would say, a lot of our practice members, Mm-hmm. And then if something else is needed, then they would go elsewhere. But okay. I think for a lot of our practice members, they look at the work that we do and getting adjusted in this way as their primary healthcare practice. Yeah.
So some people, when they think of chiropractic, you sort of touched on this a little bit, but some people, when they think of chiropractic, there's sort of more what looks good on TV and such. The I'm in significant pain and the doctor gives me a quick adjustment and everything is all better. And usually that quick adjustment comes with loud sounds and maybe screams or such. Definitely sort of the TV dramatization of chiropractic work. But how does, with that in mind, what is coming in to see someone in a BGI chiropractic look like?
Sure. Well, for one, I think oftentimes that, for one, I don't watch much TV, but for two, I think what you're describing is what people often sort of think of as chiropractic, sort of typically what people think of, where you take a joint and you move it quickly through a range of motion to free the joint, reset maybe proprioceptive mechanisms, affect joint tissue, that kind of thing. And for something where that is the thing that's going on, that may be absolutely appropriate. For a lot of situations, I think, where people are dealing with chronic or long-term things, the reason behind that joint dysfunction may be much more complex and will be reflected throughout their entire body. Mm-hmm. In other words, you can't just make what people call a bad low back, right? I mean, the low back and the entire skeleton and all of the viscera and all the connective tissue are connected and constantly sharing information and modifying how to express themselves, how to maintain upright, how to deal with gravity, how to move through space in order to minimize more harm and also maintain upright and deal with the big stuff, basically. So in that light, for most of us, what we think of as normal aging is really an accumulation of force frequencies that our bodies have taken in that they cannot integrate and can't thus recover from. And we find a way to kind of store all that in this body and move along to the best of our ability. And as we get older and we accumulate more of that, that's just what we think of as normal, right? And in fact, we know that it doesn't have to be that way, that with the right input, we can actually start to use those stored tensions, realign the system, recreate flexibility and ease and an accurate picture, internal picture in terms of the nervous system's sense of what it's doing and what's actually happening, to bring them into a place where that's coherent. and that change can happen at any age. I mean, we don't grow out of that, people tend to think that once they're an adult, that their skeleton is a fixed event and doesn't change unless it's injured. And then that doesn't change either. And in fact, we're replacing every bone cell in our skeletons multiple times a year. So you can't just have a bad back for 10 years. You're making a new bad back all the time. Or you get in there and you work on it and you change and the blueprint changes and then you start making a better back, right?
Mm-hmm. Yeah, so, I think in terms of bone health that we have this, because most people's experience with bones are the dried out rock-like skeletons that either from after having cooked their chicken or having or working with the skeleton models, that's not what a bone is. I mean, that's part of what a bone is, that the calcium deposits and such, but it also is this flexible, elastic structure to it. And I've heard the idea that if you take a fresh bone and you stick it in a vat of vinegar and you get this sort of rubbery, bouncy thing, that's as legitimately a bone as what we tend to think of as the hard calcium structure.
Yeah, and we lose track of this. Really, bones and joints are dynamic. We're constantly building bone, and we do that in response to the stresses that the bones are loaded with. So that's why older people, if they start doing weight training, upper body stuff, you can actually measure in a few months on X-ray bone growth in the places where those muscles insert. And so we think of this as just something that's going to tip down off the pier as we get older, but actually it is dynamic. And that's part of why an osseous adjustment can work. It's also part of why, as we work with people and develop those really locked tissues and unlock and recreate flexibility again, posture changes. Posture change means that we load force frequencies through our systems differently and we become healthier. So yeah, it's not the fixed event that we sort of think it is. Even the gut, when you look at the gut, the lining of the gut, we replace the lining of the stomach 5 times a day. I mean, that's a lot, right? So just because we had a something 2 years ago doesn't mean we have to keep having it.
Well, I feel like that's a great note to go out on. It was really great having you on to talk about chiropractic. Thank you so much for being here today.
Thank you, Irvin. It's a pleasure.
That was Grace Johnstone talking about her chiropractic practice and Hardwick Chiropractic. Tune in next week to hear about her work with hyperbaric chambers and how that can help you, and her nonprofit Hyperbaric Vermont. You've been listening to Resilience Radio. The music is brought to you from Aaron Marcus, a local musician and they're tuned some biological process. For full credits on that, check the show notes. You've been listening to Resilience Radio, and until next week, take care.